it's a pleasure to be here, and thank you to Leslie and the WOW Conference for creating this piece. I think it's such an important venue to allow people to teach and for us to share and understand that there are alternatives to our ailments and our sufferings. So, you know, depression, mental health problems are rampant in our society. I was looking up some statistics last night, and it's estimated that 1 in 5 of us have a mental disorder. And that roughly translates to about 46 million people in the United States. Depression by far is probably a leading cause of that, lumped in with manic depression, schizophrenia. But it's something I think we all know someone that has anxiety or depression in our lives, if not family members. So, you know, and it's estimated also that something like about 17 million people alone have depression, have been diagnosed with depression. And it is right now a leading cause of disability for people in the United States. It's #1. And it costs employers something like $16 billion a year. And there are approximately 10 million people out on disability. I can't tell you how many forms that I fill out for disability because people are non-functional and can't work. They can't, you know, just even do basic tasks, let alone do their jobs. So it really is quite a problem. Depression per se, the first incidence of depression really begins about age 14 and a half now. We're seeing it younger and younger than we used to. The highest incidence is usually, as we probably know, in women, ages around 15 to around 54. And again, the number is in the millions. So there's been a 400-fold increase in antidepressant prescriptions and treatment over the last several years. That's huge. In 2020, it's expected that depression is going to rival heart disease as the #1 burden in our society. And again, you know, this is something that can be treated holistically instead of giving the #1 drug, antidepressants, mainly the SSRIs now, the Prozac, Paxil, Zoloft, which, as most people know, causes extreme side effects. That's why a lot of people just don't want to be on them. But if they go to a regular psychiatrist, they have no other choice because it's what we're trained in. We're trained in treating a disease, the Western model. Psychiatry, interestingly enough, is one of the last specialties to begin to change over to holistic thinking. It is really difficult. I talk with colleagues, they just don't get it. Vitamins, oh, okay, you can take your vitamin, it's okay. But we need your Prozac, you need this, you need that. So, and, you know, my feeling is that they don't really work. I think a lot of it is a placebo effect, quite honestly. And there's actually now studies that are written and papers that are written that they work about half the time. I'm not saying they don't work at all. I think there's reasons for everything to be on our planet. And antidepressants and psychotropics, they serve their purpose. Certainly if someone is very violent, you need Thorazine, you need Haldol, you need these things to calm people down. But I think there's been such an overuse of these medications. When you go to a psychiatrist, not a lot of doctors start to look at the whole body, and we need to. That's what we're leaning towards. We need to look at thyroid, We need to look at inflammation in the body. We need to look at the adrenals. We need to look at clearing the gut. All things that you've heard today, just in this afternoon, are all causes of why antidepressants do not work oftentimes. And oftentimes we don't have enough nutrients in our bodies to even allow antidepressants to work. So let me just give you a little background of, let's say, how an SSRI, serotonin reuptake inhibitor, like Prozac, works. First of all, how serotonin is made in our bodies is it's made from vitamins. We need B vitamins, we need omega-3s, we need amino acids, such as tryptophan, 5-HTP, which is made in a certain part of the brain. It comes down, there's a little space between two neuron messengers. The serotonin is deposited in this space, and then it goes and connects to another neuron, and it then feeds our brains in a simplistic way. So in our bodies, when we have this serotonin sitting in this pool, what happens is it starts to get reabsorbed back into that messenger transporter, and it's lost. So how Prozac and Paxil and all these medicines work is it tries to block that reuptake, called serotonin reuptake inhibitor, so it inhibits it from going back up. And so thus we have more serotonin available to then move on to the other pathways if we're looking at, how they connect. So the problem is that, well, what if we're not making enough serotonin to come into that pool? What do? We're depressed, for sure. And so you go to your doctor and you get Prozac. And so what's happening is you don't have enough of a pool sitting in there. If you've got 2 serotonins sitting in there and you need 100 to feel better, you're taking Prozac, you're having major side effects because it then is a toxicity into your brain, into the nerve cells, and you're not really feeling all that much better. You may feel dull, but your mood isn't always better. And I think a lot of people would feel, oh, I feel a little bit better, but I can't feel life anymore. I can't process my emotions. I don't cry anymore, so that's good. So to psychiatrists, sometimes we say, oh, we're making progress, but is it progress? No. So I think that's why, at least with the serotonin reuptake inhibitors, what I've seen, and when I look at this model, is they don't really work because we don't have enough of our own reserves. Giving Prozac doesn't give you more reserves. If you're not able to make your own serotonin, what are you going to do? So what do you do? So when we look back to, when we really think about healing, in the other modalities, and we're still unfortunately very divided in medicine today, where we're now looking at how to help blood pressure, how to deal with stress, how to combat all of these diseases, such as heart disease, and we're looking at the holistic ways. But no one is really taking a look at psychiatry. So what we have seen, and some of the research is now showing, is that if you have enough stress, inflammation, different problems in your body, a genetic predisposition where you cannot process to make that amount of serotonin, if you don't have enough B vitamins, if you have trouble methylating B vitamins, meaning break them down even when you're taking in your leafy greens and all the good food and all the organic food. So we take this back to the core issue of what causes all of these problems. And it really is a micronutrient deficiency or enzyme deficiencies. If you've ever looked at a chemistry textbook or a biochemistry textbook, there are just huge pathways and steps to get from point A to point B to point. And we all have these deficits in our systems. It's just what degree do we have that? And that's why we're seeing a lot of the psychiatric disorders, autism, ADD, in kids that are running a spectrum now. And we don't even know, as psychiatrists, how to categorize it, how to even give them a diagnosis so the insurances can pay for their medications. And I think it really is a level of where and how many enzymatic or micronutrient deficiencies someone has. So how do you really go about treating that? There is a very nice, simple, natural way to treat these things. And it is with a micronutrient supplementation. So I use a very specific product that comes out of Canada, and it's called Empower Plus. And this, I have used a lot of supplements. My journey along the way to learning how to really treat holistically, I was trained, obviously, Western psychiatry, and have done inpatient work for years. I still work in a prison, paying off some karmic, not even karmic debt, monetary debt, just trying to put a holistic thing together. Anyway, we need to, these particular supplements, they're very different. I first started doing energy work, and so intuitively I'm looking at people, and I'm looking at this and that's off in their system, and I'm giving them Prozac, and I'm giving them Zoloft, and I'm thinking, this isn't working, but okay. So then I finally came upon this supplement, and I've used different supplements along the way. There was nothing like this particular supplement. What's different about it is they have very specific transporter molecules that take these substances straight into the cells. They also have a very unique micronization process where it takes 4 days to make the powder. So when you take this, we really are wanting to call it a micronutrient medication rather than a vitamin, because it works that profoundly and that strongly. It goes right into your cell. So what happens is when someone's on a medication, it begins to detoxify them, and it pulls the medications out of their cell wall into their bloodstream. And so their doses inside their body are usually double or triple in a very short period of time because of the micronutrients. They're being treated. Just to give you an example, someone that has a panic attacks, they can walk around on 10 milligrams of Valium and be fine. If you don't have a panic attack disorder, if you were to take Valium, you'd sleep for probably 2 days. So this is what happens when we start giving this particular supplement along with amino acids, which are the building blocks of the serotonin, is they no longer need that amount of medication because their body is already beginning to heal. So we have to start titrating their doses down, like probably on a weekly basis. And sometimes it's half, sometimes it's a quarter, sometimes it's an eighth, sometimes it's a sliver. So this is the new way of treating. We've had fantastic results from people that are psychotic, particularly works really well with mood disorders. And I encourage all of you, to, if you know of anyone, just to let people know that there are alternatives. And hopefully you have at least a little bit of an understanding of that we're needing to get to the core root and not just put a Band-Aid on it. Because when we get these nutrients back in our body, then we have more of a pull of that serotonin, and it can go off and do its thing. So the body naturally makes it, which is very different than the toxins that start to happen when we take these medications. So on that note, we do have a table. If anyone wants to talk to me further about this, I'd be happy to do that. And thank you for listening.